Hi, and welcome back to Straight Ahead. This is Chris Faddis, and I'm excited to bring another episode to you with one of my good friends and really one of the leaders in the price transparency market and free market healthcare, Kirk Fallbacher, who's the CEO and president of Advanced Medical Pricing Solutions, or AMPS as we call them. Kirk is an important part of our extended family at Solidarity HealthShare and has been involved in this fight for a long time and has a lot to offer. You know, in the first couple episodes of this series, we brought you Katie Talento in a pre-recorded conversation talking about price transparency. We spoke to Brad Hahn, our CEO at Solidarity HealthShare, and then we revisited with Katie Talento on the current COVID crisis and price transparency. And I'm excited now to talk to Kirk, who's an important part of our team, about what we're doing as Solidarity and AMPS to help continue providing this ethical and affordable healthcare, fair and just pricing, and really continuing to innovate in healthcare. So, Kirk, welcome to the show. Thanks for joining us. It's good to see you. With all this COVID stuff, we're not in as many in-person meetings, so it's good to see you again.
Same here, Chris. Thanks. And thanks for letting me talk with all the members of Solidarity. We really like what your mission is, and we're excited to support you guys and sort of carrying out what's fair pricing for everybody.
Yeah, let's start there, because I think you and I, when we first met, we really talked a lot about this idea, that when we talk about price transparency and fair pricing, I think a lot of times, sometimes providers get a bad rap, and there are providers who, deserve a bad rap because there's some issues there. But I think, one of the terms that I loved from you is, as you said, fair for all pricing. And we at Solidarity have, we've been using the term fair and just. So tell me what that means to you. What is fair for all pricing?
Sure. I think that's a real important point to make, is we don't want to underpay our providers. We want our hospitals to have state-of-the-art equipment. Our doctors go to school for many years to learn how to take care of us. So we want to make sure that we're paying them an appropriate price. But at the same time, we don't want to be overcharged by what might be middlemen that are in the system. So when we talk about fair for all pricing, we're really focusing on the member or the patient and the doctor and the hospital, and making sure that both sides of the coin are equally balanced.
Yeah, Kirk, one of the things that when I explain this to people, we talk about is, if I have to go to surgery or my wife or my family member has to go to surgery, I want that surgeon to have slept on a really nice bed. I want their, not to be stressed out about paying off their student loans. We want them to be, to be well paid. I think we in America believe in just payment for goods and services, right? But the idea that sometimes we can overpay, and what most people in healthcare don't look at is the individual. And if we at Solidarity, and I know you agree with me on this, if we look at the dignity of the human person, then every decision we make has to be about the individual and how it impacts them. And so where we've gotten off track in healthcare is that we seem to have gone down this path of, well, it doesn't matter to the member, to the individual, because their insurance is taking care of it. But in the end, it drastically matters, because if your pay is cut because your employer is paying X amount a month in premiums or those kind of things, it affects you. So this idea of fair and just is, yes, we've got to pay the provider well and proportionally to their services and their expertise and what they're providing, but we also have to make sure that it's not going to bankrupt the individual, which is, an important piece. So tell me more about, I think, go ahead. Sorry.
I was going to say, I totally agree with you. And I think the reason why the prices have risen is that there's a middleman between us as the consumer of the good and the hospital or the doctor that's the manufacturer of the good. And if you look at other industries where there's a middleman, that middleman always takes eventually too much out. Think about, for example, OPEC. Between us and oil was OPEC. As soon as we got into the shale business in the U.S., the price of barrels started to drop down.
Right.
My family and I, when we would go to Mexico on family vacations, between us and Cancun was the Apple travel agent. Right. As soon as I could use Expedia or Travelocity or book it on my own, all of a sudden it went from a $6,000 vacation to a $3,000 vacation. So that's the same phenomenon that's occurred in the healthcare market. Between us as the patient or the consumer of the good and the hospital or the doctor as the provider is a middleman. And that middleman is responsible for things like contracting and accessibility and establishing rates. But here's the deal. They're not incented to bring prices down. They're incented to grow their own revenue. So what's happened across the US is that healthcare prices have risen dramatically. And they've risen so much that now this pendulum that swings from quality and then it goes to cost, then it goes to quality, it's now swung back to cost because so much of that cost is moved from your employer to your household, or it's moved from your network provider to you as an individual, that it really isn't fair.
Right.
So
right.
There's a better way, and the better way is what you're doing in Solidarity. It's where the members go directly to their providers or their hospital and they pay a fair price. And the beauty of the Solidarity program then is that there's a stewardship obligation to make sure it's the fair price, and asking, is it the right price, before you ask your brothers and sisters to help pay for something.
Yeah.
So the opacity that's in the market makes it really hard. And that's what we focus on at AMPS, is bringing transparency into pricing.
So Kirk, I love that you talking about that individual piece, that we go to the provider, and then Solidarity and AMPS are there to help with any sort of negotiation. One of the things I love about what your company does is providing the data that tells us, because it's easy for someone to say, no, this is the fair price. And I say, okay, well, it looks like the fair price, but there's a lot of variability, right? In marketplace and in location and level of service. So the amount of data that AMPS is using to help come to that. So, we often talk about Medicare reimbursement, but what are some of the other kind of data points that we're looking at when we're looking at fair and just pricing?
Sure. So the first data point I'd say is how much of that bill are mistakes. And if you do some research on this, you'll find that the Center for Medicare and Medicaid Services, they'll tell you like 99% of the bills have errors on them. So there's a lot that's happening in a hospital environment. As a matter of fact, if you peel back the cover and you go into a hospital environment, there's something called an electronic medical record. And that's where all the clinicians and the nurses, they keep all the information about what they did during your course of treatment. And then that data is exported to a revenue cycle management system. And that's where they start to generate the bills and the invoices to you for all the work they did. Sometimes this is across the hall. Many times that data is exported and it's sent across the country. It could be even in another country where they're doing what's called coding optimization. Coding optimization is where you look at how something's coded and you figure out if there's a way to make more revenue for the hospital or the doctor by recoding it. So the first step is not really pricing transparency. It's actually starting with a clean claim and making sure that the claim that you're using doesn't have any bills on it or any mistakes on it. So when I say claim, a hospital renders a claim, we think about that as a bill as sharing members. So when that bill comes in, we want to make sure there's no mistakes on it because we don't want to pay for mistakes. Now we have a clean bill. Now we can put it through our repricing engine. And Chris, it might make sense for me to talk a little bit about how AMPS got started in the pricing business. So we started 15 years ago, and our job was to keep track of providers that were friendly to self-pay patients, keep track of which encounters or bills had errors on them, and then reprice the bills to what we thought was a fair amount. And we started literally with 4 or 5 people, a doctor, a nurse, and 2 engineers. A bill would come in. The doctor would look at it and say, I would never do that procedure given this situation, or this line item was never done. We would strike those line items from the bill. We would then pay the doctor or the hospital what we thought was a fair amount, and the nurse would explain to the billing office any changes. Our 2 engineers kept all that information inside of an Excel spreadsheet. Now, fast forward 15 years into the future, we now have 15 years worth of accumulated data about where the errors and mistakes are at, the upcoding and the coding optimization is at inside of a bill. We know which providers are friendly to self-pay patients, which ones upcharge, which ones had upcoding in many of their different routines. And then what happens is we have machine learning software and 24 physicians around the country that review those bills to make sure that the line items are appropriate. Then it goes into our engine. where we have that same machine learning software and a bunch of algorithms that figure out how would we price this? Should we price it like a Medicare patient? Should we price it like a fully insured person at an employer? Or should we price it to what we think is reasonable in the market, given all of the data points that we have? So that's what our system does. It cleans the bill, and then it prices the bill fairly within a 3-digit zip for that particular encounter for that provider. And then our team, if there's ever a call about, hey, we charged $10,000, but we only got paid $3,000, what happened? We'll then explain why the bill was paid at a less dollar amount because of the mistakes and the overcharges.
You know, one of the things that I love, and I thanks for that explanation, because I think it's important for people to understand. You know, what I love about AMPS is that you guys have been in this business for a long time and continue to grow and learn, and that the data from 15 years ago is even still informing, you know, today, right? And we're continuing to build. And in a lot of ways at Solidarity, we've really learned a lot over the last 4 years, and you know, saw from a model that was just repricing to, you know, where some of the lacks were, and some of those things were those medical bill reviews, and, you know, adding those pieces in, some care navigation on the front end, which we're now doing with your support. But having that data and being able to have that conversation where we can actually have real conversations with providers when we're underpaying them, and we can go, you know what, you're right, the data here shows that we should pay you more for this, or the other way around. But one of the things that I think is really important is people understanding why it's so important. So when you speak about the waste in healthcare, the amount of times that things are upcoded when they shouldn't be, or the amount of times that things appear on bills that never even happen. You know, my own family, you know, there's a NICU neonatologist on my wife's medical bill from our daughter's birth 20 months ago. It's still there. We're still fighting it. The person never appeared. They were never requested. It's nowhere in the chart notes, but they're trying to bill us $500, right? So those are things that are happening day in and day out. And this healthcare waste that we hear about, $4 trillion in spend, with at least 30 to 40% of it, maybe more, being waste. The importance of what AMPS is doing to help us to make sure we keep our member dollars, you know, stable, and that we don't have to increase. So, you know, I'm going to lob a story to you, and I'd love for you to explain this in your way. But, you know, we recently had a member that called and said, I don't understand. This provider billed this, you guys paid this, now they're sending a balance bill. Why don't you just pay them what they want? And one of our leadership team actually had a conversation with the member and said, would you like to pay what they want and then pay 4 times what your share amount is and your monthly contribution? Or would you like us to hold the provider accountable to what's fair and just and pay that so that you can continue keeping your share dollars at the amounts that they're at? And he said, oh no, I want that option. Yeah, keep my monthly contribution. So let's talk about, because I think there's a lot of providers out there who want to play nice and want this as well. But there's definitely those that are harder to deal with. So talk to that about why it's so important that we do hold up a flag and say, wait a minute, you're overcharging me here.
That's right. The reasonable and customary is a real big deal. It just doesn't feel ethical or even biblical to be overpaying for services or paying for things that weren't rendered, and then asking your fellow members to help contribute to that bill. Mm-hmm. So then you go to, why is it overcharged, or why does it have the mistakes? Many times it's the third-party company that goes through and does the actual invoicing for a hospital or a doctor. They do that upcoding, or they just might purely make a mistake. I'll give you an example. We had a $71,000 ultrasound come through. Somebody simply just double tapped the key. They resubmitted the bill after our doctor said that's too much. They resubmitted it at $710. And then we told them it was $526 too high. So as you start to talk to the doctors and the hospitals that say, well, I expected to get paid more, and you point out the mistakes that might have been on the bill, you point out the last 6 times they accepted our payment, why aren't they doing it on this time? You could also point out, for example, that you have so many members in a given zip code that would like to use their facilities. Would they like to be a part of our provider finder, where we actually steer the members and say, hey, here's a friendly provider to the ministry? So all of those things have really good benefits to the doctors and the hospitals, because they're trying to treat people locally and they want to build a local relationship. Our job at AMPS And sort of, Chris, your job at the ministry is to facilitate that relationship.
Mm-hmm.
Occasionally, you'll get hospital systems where they say, we're not going to accept anything less than what we build. And then that's when we go to work. That's when we take all of our statistical data, we take all of our negotiators. If we need to, we bring in our settlement team, and we work with those physicians or those hospitals to reach a good amicable agreement for both parties. Sometimes it takes a while, and the billing system continues to generate bills if the outstanding amount isn't paid. That's your point about a balanced bill. If it sees that there's still some amount due, it'll keep sending out that piece of paper every week or every 2 weeks in an attempt to collect more money. But the rules that we all follow are, if a bill's in dispute, you have to stop harassing the person
Mm-hmm.
and let the dispute go through its process. And that applies to healthcare. It applies to buying a dishwasher. It applies to buying a car. Those same consumer credit protection rules, the same Fair Credit Billing Act rules, they apply to everything for us as consumers. So we use a lot of that also in our discussion when talking with a hospital.
Yeah, it's really an incredible process, and it does take time. What are some things that members can do to help that process, or to kind of work with us in that process that you found have been successful when members are when we're all playing on the same side?
Yep, sure thing. So number one is, if you go to a provider and we've then received the bill in, it was processed for sharing, and we figured out what the fair price would be. We took off all the mistakes, all the charges that weren't necessarily a part of the services that were rendered. And the provider calls you up and says, hey, we want to collect more money. Basically, the first thing you do is you contact your Solidarity team. Mm-hmm. And there's an AMPS advocate who works directly with you as a member to explain the process. And the process is now AMPS will become the one that talks to the doctor or the hospital and explaining why the bill was paid at a lower dollar amount. And then we have a bunch of data that we provide to the doctor or the hospital that shows them the mistakes, the fair pricing in their market. So what you as an individual can do, the most important thing is work alongside of us in the process. If you get any letters, send them to us. If you get any phone calls, let us know about them. And then know that we're really working on your behalf. What we found is that 9 out of 10 times these bills go away after the first phone call. Mm-hmm. From AMPS back to that provider. And for that 1 out of 10 times, they might want a few more letters. They might want a few more phone calls for us to discuss it. They might actually want to do a settlement. And maybe they're right. Maybe in the Fair for All world, we do owe them a little bit more money. So the key here is to understand that we're really advocating on your behalf, and we're talking to that provider trying to get to what a reasonable amount is.
Right.
And by the way, if that provider does accept the reasonable amount, it's likely that they're going to accept that reasonable amount for the next time you go in, or when other members in your area go in. So what we then do is we have a provider relations team that sets up a long-term contract with that provider so that any of the Solidarity members can go to that same physician or the same hospital and know that they're going to have a fair price.
Yeah, it's really an incredible process as we kind of get to that point of improving. And one of the things, Kirk, I'd love for you to speak to very briefly. We only have a minute and a half left. Is the improvements that Solidarity has made, because you've been a key advisor to us as we've been making some significant investments on software and new processes and systems, because one of the benefits, right, is we need to pay those providers quickly, which in our current systems we've been unable to do, so that the providers are happy, because when they're getting paid, they're happy to receive it, and it's a better relationship. So could you speak to that? Because I'd love for people to hear from someone else kind of the efforts that are being made here.
Sure. And Chris, your team is doing Herculean efforts. If you look at it, you mentioned one thing: days to pay. A doctor's office, a hospital, is just like any other small business or a large business. They live on their accounts receivable and people paying them on time. So one of the first things that was a yeoman's work effort was to get all the bills in, get them into a new system, figure out how to clean them, scrub them, reprice them, and then get the payment out the door after doing all the needs processing for the ministry. And that takes some time. And the longer that takes, the more the provider goes, am I ever going to get paid? And how much am I going to get paid? And they get upset and upset and upset. But now, through a lot of the efforts that you and your team, and combined with many others that are working on it, we're going to reduce that days to pay number way down. So all of a sudden, it's like, oh, well, you said I was going to get paid less, but I might be willing to do that if I get my cash faster. The faster you can get the cash to the provider, the happier they are. So that's one big benefit. The second big benefit is by turning on the system that AMPS does, where we're in the cost containment business, and we have people that have 20, 30 years experience in just looking at bills, figuring out the right price, discussing with the provider what they should receive. By turning that on, just by nature, you're going to have a more equitable exchange for every healthcare dollar that's spent. So your money's going to go further. For example, on facility bills, it's very common for us to be able to get upwards of 70, sometimes 80% off of the gross billed charges number, because we can figure out what a fair price is. If you look at things like maternity or cancer treatments, musculoskeletal, those have a lot of fluff in them, meaning fat and price markups, and we bring those right back down. So overall, your membership's going to enjoy the ability for, when the monthly shares start to come in, you're going to be able to help more members paying their healthcare bills in mass.
Well, one of the things, and I'll
that's
close
another
with
big
this.
benefit.
I'll close with this today, Kirk, is that, and thank you for that, is one of the things that's been great is just in the 6 months that we've been working together, and AMPS has been doing the repricing work and helping us. And we're still working through the backlog of some of those old balance bills and things that we're working through. But in that repricing process, we've already seen a net gain in discounts of about 8%. So already our members, month over month, the sharing dollars are stretching. In some months that's $700,000 that is more money that's going towards sharing of medical needs, which means we've expanded our ability with our same contributions. We've expanded our ability to share more dollars. And that's an important piece. And that will continue as we turn on more of these systems. So I can't thank you enough for your friendship, your guidance, your leadership, and your team's work on our behalf. I think our members, as they get to know your work over the next coming years, I think they're going to be very grateful as well. It's been an incredible partnership. So thanks for helping me, this effort to educate people on price transparency and the work that we're all doing. God bless you and your family, and I hope to see you again soon. So thanks again for joining me for Straight Ahead with Kirk Fallbacher from Advanced Medical Pricing Solutions, or AMPS, who's one of our key partners at Solidarity HealthShare, in full disclosure, but also an expert in price transparency. We hope to bring you more of these episodes, so please stay tuned every week for another episode of Straight Ahead.